Hello, my name is Elif. I make anatomy and medicine videos. If you like my videos, please subscribe my YouTube channel and follow me on my Instagram and Facebook pages. Hello, in this video I will talk about the external anatomy of medulla oblongata from ventral aspect. From caudal to cranial, there are three different parts of brainstem. These are medulla oblongata, pons, and midbrain. In this video, we will focus on medulla oblongata. Medulla oblongata, also known as medulla, bulbus, or myelencephalon, is the most caudal part of brainstem. It is located between pons and spinal cord. Medulla oblongata is situated in the posterior cranial fossa, under the tentorium cerebelli. In shape, it resembles an inverted cone with the top removed. Anterior surface of medulla oblongata, in other words, ventral surface, faces basilar part of occipital bone and dense axis, which is a structure of second cervical vertebra. Basilar part of occipital bone is also known as in Latin pars basilaris os occipitale. Posterior surface, in other words dorsal surface on the other hand, faces the fourth ventricle of the brain. Fourth ventricle is also known as ventriculus quartus in Latin. On the inner side, central canal, it is also known as canalis centralis in Latin. Central canal in the spinal cord continues above as ventriculus quartus. The upper margin of medulla oblongata is determined by bulbopontin sulcus anteriorly. It is also known as sulcus bulbopontinus in Latin. Just because it is a junction between the pons and bulbus, it named as bulbopontin sulcus. In some sources, it is referred as medullopontin sulcus. Bulbus, medulla, myelencephalon are other names of medulla oblongata as I mentioned before. Inferior margin, on the other hand, is marked by the first pair of cervical spinal nerves. This is at the level of foramen magnum. Posteriorly, there is an important neighborhood. The alignment of the lateral recess, it is also known as recessus lateralis in Latin, located on the lateral walls of fourth ventricle from the posterior side. Fourth ventricle is also known as ventriculus quartus in Latin. Quarto means fourth. Medulla oblongata carries many ascending and descending pathways that carry information between brain and the spinal cord. It is also the center of vital functions such as heart rate, blood pressure, and respiration. Medulla oblongata hosts the four most inferior cranial nerves. These are 9th glossopharyngeal nerve, 10th vagus nerve, 11th accessory nerve, but cranial part of accessory nerve, 12th hypoglossal nerve. Now let's take a close look of external structures of medulla oblongata on ventral surface. Ventral surface has some distinctive structures. These are one fissure, two sulci, the pyramids, the olives, and some cranial nerves. In the midline, there is main fissure that known as anterior median fissure. It is also known as fissura mediana anterior in Latin. Anterior median fissure is the continuation of anterior median fissure of spinal cord. This fissure goes as far as to the pons into a hole called as the foramen of Ventral. It's a triangular shaped area that located rostral to the anterior median fissure of medulla oblongata, and it is also known as foramen secum of medulla in Latin. The protuberances on both sides of anterior median fissure are called as the medullary pyramids. In singular form in Latin, it named as pyramis bulbi. These two parts fuse with each other in the midline of the lower half. This is the part where approximately 90% of the corticospinal tract fibers cross the opposite side. And this is a border between medulla and spinal cord. This decussation, known as pyramidal decussation or decussatio pyramidum in Latin, because of these fibers are motor fibers. In some sources, you can see this decussation as decussatio pyramidum motoria. Ventral medullary has two sulci bilaterally. One of them which is the near with the pyramids and located on the anterolateral side, known as anterolateral sulcus or sulcus anterolateralis. In some sources, it known as ventrolateral sulcus. And on the posterolateral part, there is posterolateral sulcus. It is also known as sulcus posterolateralis or sulcus retroolivaris. Between anterolateral sulcus and posterolateral sulcus, there is olive-shaped oval structures which known as olive in each side. This is also known as oliva in Latin. These are bulges formed by the inferior olivar nucleus that located inside of them. The groove connecting the oliva to the cerebellum and medulla oblongata, posterior to the oliva, there is posterolateral sulcus, as I mentioned before. From this sulcus, 3 cranial nerves exist. From rostral to caudal, these cranial nerves are 9th cranial nerve, glossopharyngeal nerve, in other words, nervus glossopharyngeus. 10th vagus nerve, which is nervus vagus, and 11th accessory nerve, cranial part of the accessory nerve, is also known as nervus accessorius in Latin. Between pyramis and oliva, in other words, from sulcus anterolateralis, hypoglossal nerve, which is 12th cranial nerve, exists. This nerve is also known as nervus hypoglossus in Latin. Let's sum up all the cranial nerves from exits of medulla oblongata on ventral aspect. Arising from the junction between the pons and bulbus, 6th abducent nerve, nervus abducens, 7th facial nerve, nervus facialis, and 8th vestibulocochlear nerve, nervus vestibulocochlearis exits. In the posterolateral sulcus, from rostral to caudal, 9th glossopharyngeal nerve or nervus glossopharyngeus in Latin, 10th vagus nerve, nervus vagus, 11th accessory nerve, nervus accessorius in Latin exists. It is cranial part of accessory nerve, by the way. And when we come a bit more anterior, from anterolateral sulcus, 12th, the last pair of cranial nerve, hypoglossal nerve, nervus hypoglossus, exists.